Neuromodulation is a branch of something called as somatic therapies, which is an important part of treatment for psychiatric as well as neurological disorders. It's not a new branch, it has been there since quite some time, though recently in the last few decades it has picked up quite a lot. What neuromodulation basically involves is stimulating the brain either in general or specific targeted areas of the brain with electrical or magnetic currents. The entire idea rests on the observation that certain areas of the brain are found to be working abnormally, either are working in excess or their activity reduces in specific psychiatric disorders. And using a variety of neuromodulation or brain stimulation, as it is generally known, techniques, it can be modified so that the abnormally working area can be brought under a normal kind of a control again. So it has been there since quite some time. There have been approaches such as electroconvulsive therapy, which has been there right since the 1930s, since when ECT has been very commonly and very importantly used for treating severe psychiatric illnesses such as severe depression where a person is suicidal, or other severe psychiatric illnesses such as schizophrenia. Recently, in the early 2000s, something called as rTMS or repetitive transcranial magnetic stimulation also got approved for treating different psychiatric illnesses, and currently it is an important part of treatment in case of treatment resistant depression and even for obsessive compulsive disorder. Generally, neuromodulation is thought of as a treatment option in cases where an individual is experiencing a lot of side effects to the ongoing medications, or has not shown a good response and is very resistant to treatment using medications or therapy and other forms of treatment. So with the basic idea is that like a generalized approach, for example, where ECT would be used to in general stimulate the entire brain, or else there will be a localized approach in neuromodulation such as with rTMS or something called as TDCS or a transcranial direct current stimulation, where specific areas of the brain which are functioning in a reduced fashion are stimulated, or areas that are acting more or are too active are suppressed so that it returns to a normal state. Using neuromodulation, a lot of people benefit in their severe psychiatric illnesses when other treatment modalities have failed, and it is something that has been found to be very beneficial and is very good and positive in terms of side effect profile. So it's something that can definitely be thought of in a lot of individuals who experience severe depression or severe OCD and apart from other psychiatric illnesses.